All right, everybody. 11 o'clock. We're going to get started here. As you can see on the screen, this is actually the first of our webinar series with Dell. This is a joint webinar series that we're hosting over roughly the next month. And today we're going to be talking about healthcare. We're really excited about this webinar series. Dell is obviously an incredible partner of Genetec's, and we hope that you gain some valuable insight from these webinars. So, like I said, we're gonna kick off with healthcare, and I think we've all seen that the world has pretty much come to a standstill, and in that, pretty much every industry has come to that standstill except for healthcare, right? Healthcare has been evolving at a pretty incredible pace, and we're going to dive into that and talk about some of the technological trends that we've seen within healthcare that have happened in a very short time frame. So first of all, I should probably introduce myself. So I'm Ty Miller, Healthcare Business Development Manager for Genetec, and I'm lucky to be joined by my friend John Hazard. John, why don't you introduce yourself?
Hey Ty, thanks for the introduction. As Ty said, my name is John Hazard. I'm one of the business development managers here at Dell Technologies for our safety and security team. I'm aligned personally to our enterprise preferred accounts. I'm really excited to be here today and partnering with Genetec in order to kick off this inaugural webcast series and discuss the healthcare industry and its many changes.
Yeah, and one quick housekeeping item. Feel free to put any questions in the Q&A window, and we'll make sure that we save time at the end to go through as many of those questions as we possibly can.
Yeah, absolutely. And to add to that, Ty, we will be answering questions in the chat window as this goes through. But again, we'll leave plenty of time at the end in order to answer any questions, and also for some of the questions that have come in that the wider audience might want to answer as well, or answer to as well. But one of the reasons, many reasons that I'm looking forward to participating and also learning from these webinars is really the industry leadership that Genetec and Dell bring together. On our own, Genetec holding top rankings in access, video, and ALPR, Dell Technologies being the #1 safety and security infrastructure provider for a number of years. It speaks a lot on our own. However, when we combine these capabilities, we truly have the ability to build solutions that will help solve our customers' needs while making it a lot easier for our partners to actually deploy those solutions out there in the market. And while some of the solutions we'll talk about today and some solutions we can put together can be adopted for other verticals, the fact that Genetec and Dell both are invested and committed to the healthcare space, it allows us to address our customers' needs uniquely. Having Genetec and people like Ty that are dedicated to the healthcare practice, focus on solving challenges by collaborating with their end users and Dell's market leadership inside of the healthcare provider space, we're really able to help our healthcare customers deploy the leading edge solutions that they desire to meet their business needs without asking them to do anything and be guinea pigs and being on the bleeding edge of unproven deployments. So with that, today, we'd like to touch on a lot of the conversations that Genetec and Dell are having together and also separate with our healthcare customers. First, I'll walk through some of the trends and challenges that we're seeing with our healthcare providers. Many of the trends have been exacerbated over the last few months, but the overall challenges that our healthcare system is seeing remains the same. Next, we'll talk about how organizations can adopt today's ever-changing environment to address both regulatory requirements utilizing flexible technology solutions. We'll also address how the solutions can help alleviate some of the challenges of today's healthcare industry. And then finally, we'll talk about how some of the recent events have needed to spark innovation of the existing technologies to help enable our medical professionals to do their jobs more effectively. So right now, obviously, there's no shortage of trends affecting the healthcare industry. And while many of these trends can seem like science fiction as the medical industry looks to utilize data to further innovate, the pursuit of information can pose some challenges for our medical professionals themselves. So we want to make sure that we keep that in mind. It's really not hard to see that there's been a tremendous amount of stress on this provider space over the last few months. Medical practitioners now have even more to think about when going into work, particularly around their personal safety. Even before recent events, there were a number of challenges affecting the industry itself, ones that will only be exacerbated again if providers don't make the proper changes as they begin navigating this new world. Primarily, it's been about addressing their employees and making their jobs easier, and to do their jobs easier. The industry itself is in a bit of a struggle with almost 13 million medical and nursing jobs set to be unfulfilled by the year 2035. Now, luckily, that information is based on a model, and we've seen with our recent situation how models can be, either underdeveloped or even over exaggerated. But what they do accomplish, what these models do accomplish, is it gives us the insight into a problem that we need to put changes in order to rectify before it actually reaches those levels. And one of the biggest impacts to the resource shortage is the amount of stress that our medical practitioners are under. The stress can quickly turn into burnout, with 44% of our physicians saying that they feel run down by their job. However, it wasn't the number of patients that they're seeing contributing to the burnout, but rather some of the medical professionals describe as too many bureaucratic tasks. And since many healthcare organizations are now managing a greater volume of data than they ever have before, because they're assigning a greater value to that data, which we have to use technology in order to help drive those customer outcomes without over-stimulating the bureaucratic tasks that our medical practitioners are dealing with. So we want to make sure that we're keeping them in mind as we start implementing these new solutions, and that's something that Ty and I are going to talk to today. In addition, the growth of telemedicine, especially in today's climate, can create even new challenges as much as it solves the much needed need. Plainly speaking, we want to ensure that we aren't adding to the bureaucratic tasks that our physicians have cited. And this data transformation in healthcare is not going to subside anytime soon. We're going to continue to see exponential growth as the world population continues to grow both in numbers and in age. In fact, healthcare data grew 878% in just the last 2 years with no slowdown in sight. In addition to the raw data, artificial intelligence and machine learning are also offering new tools to identify disease, develop treatment plans, monitor health epidemics, and really accelerate that medical research. It's amazing that we're at a point in our technology where we can utilize this technology in order to drive insights, but in practice, we have to ensure that we aren't giving our medical professionals analysis paralysis. Instead, we want to give the physicians and nurses what they need to be augmented by this technology while making sure they have time to do what they do best, and that's provide personalized care to their patients. We help accomplish this by allowing our healthcare professionals to focus on the task at hand by orchestrating some of these routine tasks while providing unique solutions that help them feel safer in their workplace. And what we're talking about today is really application transformation, which is part of a larger strategy in healthcare. Utilizing IoT devices, whether they be cameras, which are optical in nature, or additional sensors, and combining with software in order to transform how our healthcare professionals provide their services. And many times this connected health transformation is brought up when we're referencing how providers are shifting from chronic care facilities in order to focus on ways that they can provide preventative care. But what we'd like to do today is really focus on the medical professionals themselves and how innovation with software can help alleviate some of the burnout concerns while helping their personal safety as they battle both today's environment and future ailments on the front lines. And for decades, Genetec and Dell have been working together in terms of deploying this for CCTV. And CCTV has certainly been an essential source of hospital information, specifically focused on the security aspect of physical security. Now we can use these cameras to drive additional insights for our medical professionals while helping providers meet the challenges and regulation that they're experiencing. This shift from the physical security aspect of it to industry-specific use cases is what we like to call computer vision. Over the next few sections, we'll discuss how our customers are redefining how they look at the role of video and security in facilities and how it can be used to help ease the burden on our healthcare professionals while providing a safer work environment. In the current situation, these solutions are more important than ever as they help enable the medical community to continue to meet their high standards while being asked to do more than ever. So with that, I'm going to pass it back to Ty to talk about how we're helping our customers adapt to these changes in regulation.
Thanks, John. So one question that you should all be asking yourself is, how are you going to ensure a safe reopening of your organization after the states ease the restrictions on the mandated lockdown? And it's very likely that these regulations are going to vary from state to state, right? So if your organization spans across multiple geographies, do you have a good plan in place to be able to contend with that? So the first thing that I'd like to start with is occupancy management. And there's various ways that you can automate and manage occupancy within your building. And I have to imagine that most organizations are going to try and avoid paying employees to stand in various entrances and exits with a counter or clicker, right? That's very manual, cumbersome, and it can, really be inaccurate. So to be able to manage occupancy in real time, you need an effective means to do three things. You have to be able to count people across multiple entrances and exits. You then have to be able to visualize and interpret that data. And then you need a means to notify certain people or groups when those occupancy levels have been reached or you're near critical thresholds. So as I mentioned a couple slides ago, those regulations around occupancy are going to vary significantly based on local guidelines. And organizations are going to be tasked with finding a way to meet the varying requirements, whether they have one local facility or hundreds of facilities across the country. And really this can seem like a burden for organizations, but in reality, it's all geared towards keeping organizations, staff, and their customers safe. So here's a look at what a customized dashboard might look like that's counting people and displaying real-time data on occupancy and a percentage of occupancy as it pertains to a specific threshold. So for example, your security and management staff can be notified when you reach, say, 90% occupancy for your building. So this is being accomplished right now through a combination of people counting video analytics as well as LiDAR people counting sensors. So end users can also leverage their access control system to be able to provide information on the movement of certain individuals as they move about throughout their organization. And depending on the access control system, this information can really be difficult to obtain. It can be cumbersome to correlate. This is a look at what a traditional cardholder activity report would look like. You've got many different cardholders being granted access to many different locations. So you would then need to take that report and correlate that with a door report like this. This is a door activities report, in order to find out where somebody's been and who else has been in those same openings. It can be very cumbersome, and depending on the frequency that you're being asked to provide this information, you might be repeating that 61 times a day. So there had to be a better way, right? So let's look at an example of how our new Contagion proximity report would work. So let's say that this person here in the red jacket has been identified as a positive carrier of some contagious disease. Well, we probably want to know exactly where that person's been and also understand, who else has come into contact with those same doors and potentially been infected, touched an infected doorknob, lever, crash bar, what have you, whatever kind of hardware is on that door. So let's look at a quick report here on how this would work inside of Genetec software. So if we take Mark Black here, we're going to identify a specific window of time that he has been in the building, and then we can identify a 30-minute window of when that person may have touched an opening that other people have touched within that same window of time. So this is actually a solution that Genetec developed to produce a report that was specifically in response to COVID-19, and it's being provided free of charge to all of our customers that have an active support plan. So that was looking at using access control or an access control system to do what we call contact tracing. But you can also use real-time location services to do contact tracing. If you have beacons that are correlating exactly where people are and who else they've come into contact with over a given time period. And this can be configurable for not just a specific time period, but a proximity of contact. So if you see on this report here, we are identifying within a 3 meter or 9 feet span which individuals have come into contact with one another for greater than 10 seconds. And all of those parameters are configurable. But this is something that we're in the preliminary stages of providing as an added layer beyond just access control contact tracing. So let's explore RTLS a little bit further, because RTLS can have many, many advantages for healthcare organizations beyond just contact tracing. Things like asset tracking and patient and staff safety. For anyone that's not familiar with real-time location services, or RTLS as we refer to it, it's a solution that it's accomplished by installing beacons in the wall outlets of a room and then placing an active tag on a person or an asset. So security teams can basically draw geofences around an area and notify staff when a person crosses over that geofence into a, we'll call it an unrestricted area. And that can generate an alarm that can be sent to security operations. So you might even equip your night shift staff with mobile panic buttons. If a nurse or some staff member feels that their safety might be at risk, they could activate that panic button at any time and send an immediate alert real time to the security operations center. Here, this is an example of where that technology would become very valuable. So this is a New Brunswick nurse that unfortunately was attacked for 11 minutes before anybody really knew about it. There was a patient's spouse that actually strangled this nurse in her office because his spouse was moved, his wife was moved to another hospital bed, and he was very irate. So the attack lasted for quite a while before anybody realized and stopped the incident. And unfortunately, that nurse sustained very significant injuries, and as you can imagine, will probably need counseling moving forward. But had she had that panic button, that could help minimize workplace violence, right? So, with the RTLS solution, you're equipping these active tags with a duress button. So essentially, your badge is both a beacon that shows your geospatial location, but it's also that built-in duress that can be pressed in any emergency situation. So here's one more technological advancement that I'd like to touch on. I know I'm kind of jumping between a lot of different technology here, but this one, if your staff are using shared workstations or tablets, you're probably going to want to limit the contact with those PCs or tablets as much as possible. So utilizing facial recognition, for easy, seamless single sign-on to that tablet or PC would be very powerful, right? And you can even enhance the security with that with a multi-factor identification as part of the process. So that same Bluetooth beacon or badge could be used to identify a person's identity and location, but correlate that with a person's facial profile or even a person's voice recognition to provide that multi-factor authentication and then unlock the workstation. And then upon leaving, the staff member gets up, walks away, the tablet or PC would automatically relock. So this is a use case that would reduce the likelihood of surface contact transmission while still maintaining tight security measures around who's accessing, very sensitive data. So I'm going to pass it back over to John. John's going to take you guys through a pretty hot topic in today's environment right now with thermal technology. John, I'll let you jump in.
Yeah, thanks, Ty. It's pretty amazing and uplifting to hear how we're using technology to address the challenges that the healthcare industry faces today. And while I think it's important to implement this technology, the most important thing I think is to have a plan and a protocol when these circumstances pop up. You know, whether it's determining what to do when someone is in distress or tracking into contagious disease, a clearly defined standard operating procedure allows actions to actually be taken. And that's especially important when implementing our next topic. And I'm sure everyone has had conversations around this today. There's really nothing in our industry that's a hotter topic, as Ty mentioned, than thermal cameras. And it seems like every day there's a new offering out there, a new company popping up touting their solution that it can detect a human's temperature, and in some cases even utilizing the phrase fever detection. However, all of the offerings are certainly not equal. And there's important factors to take into consideration when looking at deploying a device to monitor elevated temperatures. To level set, thermal cameras aren't something new. They've been used for years to detect abnormal temperatures on things like combustion controls and mechanical conditions, and to predict maintenance requirements on things like oil rigs. These cameras are now being repurposed to identify elevated body temperature, but on their own, they're going to do what they're meant to do, which is detect temperature variance in an object, and that's whether it's a person or a hot cup of coffee. What we define as thermal vision takes thermal cameras a step further by combining it with artificial intelligence to recognize slightest changes in elevated temperatures to create those actionable outcomes that are part of your standard operating procedure, as I mentioned, for this specific use case. And while the thermographic imager is important in providing accurate readings, this one that we're speaking about today can actually provide an accurate reading of around 0.1 degrees Celsius. The artificial intelligence is making sure that the temperature is being detected from the area in question. Thermal vision uses facial targeting technology to recognize the inputs on a person's face and determine the best place to take their temperature. For those of you that have done any research in terms of how the relation between core temperature and contact temperature, might know that the tear duct is actually the most accurate place to read temperature. But what happens if someone's wearing sunglasses or reading glasses? Well, the facial targeting technology is actually able to identify different spots in the face in order to determine where the best place to take that temperature is, whether it's the tear duct. If it can't get to the tear duct, it might move to the nose or the mouth, the forehead, the ear, and in even some cases the artery on the neck, in order to verify if someone needs to have that secondary check that's part of your SOP. And this technology helps reduce both false negatives as well as false positives. False negatives from situations where the camera cannot read its desired location on a person's face, say it's the forehead and the person's wearing a hat, and allows them to proceed through the checkpoint. And false positives when the thermal camera detects something else, another object inside of the frame of view that that's above the threshold, so say a cup of coffee. And however, as I mentioned in the previous slide, having a clear policy how to proceed in each situation is important. When I discuss this thermal vision technology with customers, the first thing I ask is about their standard operating procedure for elevated temperatures. Thermal vision is meant to augment their existing policy and make it easier to process people coming into facilities more quickly. At this time, many customers are testing each individual's temperature as they walk into the building because they need to have essential employees back into work. However, that's certainly not scalable in most situations. With our thermal vision solution, it can monitor up to 3 people from 15 feet away every second, while using the AI technology to actually capture those faces and pull them aside in order to have them go through the next step inside of your company's process. In addition to the AI technology, we've also implemented enterprise management solutions for fleet management of both the thermal vision solution and other pertinent IoT devices. So in terms of the hardware, thermal vision can certainly be deployed as either a centralized solution that resembles a standard physical security deployment or a mobile cart solution. And most of the customers I'm speaking to today about this, they're actually opting to go with a mobile cart, which is a surprise for me, being from the physical security space. But it's really about faster deployment as they look to determine what the best path of entries are going to be inside of their facilities. When we talk to other facilities outside of the healthcare industry, particularly around stadiums and arenas, they actually have those natural parts of entry. So they're looking at a more centralized version. But in terms of most of our healthcare facilities we're speaking to, the cart solution is actually the one that's been taken off. This cart contains a camera. In this case that you're seeing on the screen here, it's a robotics camera. It does have a dual lens, so a thermal lens as well as an optical camera, which allows it to stream back into a security center, along with a touchscreen monitor, a workstation with a GPU in order to handle that AI technology, a UPS for backup power, as well as a router. The router actually allows this cart to connect to 4G LTE service, so that it doesn't have to sit necessarily on the network or for secondary access. This has been another request from our customers that we're seeing in a lot of the deployments, as again, they're trying to get this out fast, get into their facilities, allow people to come in, and then later they'll handle hanging up the cameras in a fixed location, running the cable, and so forth. The router also allows the cart to connect to the cloud-based services for remote support and installation. In general, it only takes a couple of hours to install, as well as the fleet management that I mentioned on the previous slide. That enterprise management enables the ability to monitor the status of the camera, workstation, and other peripherals from a centralized location. And since these are mobile solutions, it's able to track the geolocation of the cart in order to ensure that this cart is actually where it's supposed to be. In addition, the platform helps healthcare providers operate inside of their standard operating procedure in an easy and scalable way. I mentioned a couple of times how important that is, and I can't stress it enough to actually have an outlined procedure in order to put in place as people start coming back into the facility. In the upper left-hand quadrant, you'll see that there's an example of those image capture capabilities that I mentioned. By capturing the faces of individuals with an elevated temperature, we're able to separate them for an additional temperature check. Through a powerful rules engine, these faces can be logged into the native notification center inside of the software, or moved into a Teams channel, Slack channel, or whatever other collaboration tool your company actually uses for further action, or even ticket logging. If it wants to go into an HR system, it's certainly possible. In all, there's around 100 actions that can be formed by dragging and dropping into this process flow and matches the customer's protocol. Finally, as an IoT management platform, there are additional sensors that can be implemented as well. The two screenshots on the bottom represent a deployment at a large hospital system in California, where they have a customized GUI to monitor both their thermal vision solution as well as the refrigeration controls in their pharmaceutical labs. This is just a really brief overview of some of the ways that we can bring technologies together to solve challenges inside of the healthcare industry, and which is certainly being accelerated in today's climate. Through Genetec and Dell's collaboration, we're able to help our customers deploy a proven, trusted solution that really helps address the needs at hand. Ty's going to walk through a few more of those examples of this creativity and ingenuity in action. Ty?
Yeah, so I'm going to share an example of how one of our healthcare customers was able to address a current challenge, and I'm pretty sure this is probably a challenge that many of you face as well. We're talking about minimizing the use of personal protective equipment, or PPE, as folks have called it. But essentially, at this hospital, every time the nurse staff were to go into a patient room, they would have to replace their PPE, right? So this obviously contributes to a really high turnover rate of that PPE. So the customer came to us and said, is there a way that we can solve this challenge by using technology and leveraging our Genetec Security Center solution? So at first they started by implementing a dome camera in the ceiling of these makeshift hospital rooms like storage closets, IT closets, pretty much every nook and cranny where they could put a patient in the hospital. And this specific camera was able to give them two-way voice communication as well as a visual view of the patient. So this solution, the nurse staff could actually view the patient and communicate, but the patient could not see the nurse. And the nurse's staff could initiate communication, but the patient could not initiate communication. So this worked so well for the hospital that they said, look, we need to implement this in every room we have, even rooms that have existing coronavirus patients. So we said, well, how do you do that? Because you can't send a technician into a contagious room to install cable and mount a camera, etc. So they came up with the idea of, let's put an audio video intercom station and attach it to an IV stand. The nurse would then roll this unit into the room and plug it into a network wall jack. And then the configuration would all be done on the other end by the security integrator technician. So this was a good enhancement over that first application for two main reasons. Number one, it was mobile, right? So you could move this easily from area to area, bed to bed. And it also, number two, it allowed the patient to be able to initiate a call with that nurse station. So this has been incredibly successful for this hospital, and they've deployed approximately 1,000 of these sensors out across their various hospitals and patient wings. So I'm going to demonstrate this application for you and how it would work with a short video. So you'll see, you can pull up a map of a hospital floor or wing. You'll see the different rooms where you have an endpoint, be it a camera or an intercom device. And then right from the map, you can gather some tactical information about that device. The green dot there shows that it indicates that the device is online. And if it's shown in red, it means that it's offline or not communicating. And you can also see a graphic here indicating a nurse station or a command post. So the nurse can go ahead and click on one of these patient rooms, in this case 8005, and that's going to initiate a call with this patient. And they're going to have bidirectional audio communication. So the nurse can then conduct a series of tests or evaluations remotely over that call without ever even going into the patient room. That's the key, right? So they're eliminating the need to replace their PPE. So here you'll see that that call can be initiated in a monitoring window, and that nurse can then keep track of other patients that they might be responsible for. So lastly, there's a built-in public address functionality in this module. So if the nurse were to select a patient from this call tree, they could select a patient or a group of patients for that matter. They could then send out a message to a larger audience or a subset of patients if they want to reach more than just a single patient. So there's a lot of functionality built into that module. I'm going to end here with one final solution, and this one is really geared around the management of the PPE, right? So we just talked about ways that our customers are able to minimize the use of PPE, but now let's talk about how technology can be used to actually facilitate the distribution of these components. So many of our customers, they're looking at ways of tracking who is taking what equipment, so that staff are more conscientious and mindful and understand that administrators are able to keep an eye on discrepancies in what's been taken and sort of create some accountability. So you can see here, this is a self-checkout kiosk where staff can sign in by using their badge. So they hit their badge on a card reader, and then they can punch in what equipment they'll be taking from the kiosk. It'll let them know the quantity of equipment that's left, and it assigns that equipment to the cardholder. So important to point out that this by no means prevents certain people from trying to abuse the system, right? There's additional security measures that can be added. For instance, you could implement access control on the storeroom or cabinet doors, and then we have a way to provide temporary access only once a request has been made. So a request gets made by a nurse or a staff member, and then they're granted permission to go and take out appropriate equipment or PPE. The other thing that you could do is you could add cameras in the kiosk area, right? And then with a unified platform, you could associate those cameras with the access control transactions to validate the items that are being taken and also validate the identity of the person taking the items. So in totality, this really just creates a whole environment of accountability, right? You can limit people that would typically be abusing this kind of system by just implementing a few additional security measures. So, this is a look at a dashboard where we're taking the management of that personal protective equipment to an even higher level with a customized dashboard, right? So we're understanding how assets are being used over a given time frame and by which individuals specifically. Maybe you have a nurse that for whatever reason takes 10 times the amount of PPE than the average nurse. We can also identify larger transactions or large amounts of PPE that are being taken over a given period of time. And then, you've got a map there that shows your access control and your video components for that PPE locker or cabinet. And that can be associated with the contextual video to show folks, that are managing this what really is happening. And also, like I mentioned before, let folks know that their transactions are being monitored. It is just going to create an environment of honesty and self-regulation. So let's bring this to a close here. We can jump into Q&A here as we wrap up. But before we do, I want to just quickly recap on some of the reasons why the Dell Genetec partnership just really makes sense. Number one, it's our proven track record in the healthcare industry. When we started the webinar, John mentioned both Dell and Genetec have dedicated teams of people that focus on the healthcare industry. And secondly, our technology is built to be open, scalable, and flexible, right? So our customers can take advantage of new technology as the needs change. So, I'd be willing to guess that most of the end users on this call didn't foresee themselves looking to implement very specialized thermal detection cameras at the entrances of their buildings a year ago, right? So being able to have a flexible and open platform gives those customers the ability to adapt to changing needs or changing environments. And then lastly, as the number of sensors and connected devices in this growing IoT world continues to increase at an exponential rate, our partnership with Dell gives us the foundation to be able to scale and to meet those needs. So with that, we went through that relatively quickly, so we have plenty of time for some Q&A. I'm going to pause for a minute and let folks just add. So there's a couple questions that have already come in, and we'll give folks some time to add. So first question, are we going to share the presentation? Yes, absolutely. We will. This webinar is actually being recorded, so this can be viewed again, and we can also provide the presentation if you'd like that. Another question came in here from one of the attendees. Will this solution work with Linnell? So I'm not sure specifically which solution you were referring to. If you're referring to the thermal solution, maybe I can let John answer that piece of it on the thermal cart. But as far as the access control and the Contagion report, those are specific to Genetec. But the thermal solution may be a more open architecture solution.
Yeah, the thermal solution is an open architecture solution. So I mentioned that rules engine that's on the back end of it. If there is a situation, we do have a couple of customers out there that are looking to tie it into their access control in order to restrict access into facilities if they do have a person detected with an elevated temperature before they go through that process. It can be implemented into almost all of the access controls. So now, certainly, yes.
Okay, excellent. Let's see, one other question here. With the video intercom solution, were you able to monitor patients in bed? Are there any HIPAA or privacy regulations that you need to be aware of? So in this particular case, this customer, this hospital chose not to record video, right? So this was meant purely as a bidirectional communication path between the staff members and the patients. and wasn't really meant for recorded forensic look back at the video. So in this case, no, they were not in violation of HIPAA regulation. But that's a good point that you raise. And I know that their HIPAA regulations have actually loosened during this time. So that would be something that we could look further into. But in this case, there was no violation of privacy. Let's see, any other questions coming in? Question on the contact tracing. Again, that is that's specific to the Genetec access control solution. And it is a free solution that Genetec created in response to COVID-19, and that is available for Genetec customers just by logging into their GTAP portal. Question here, do I need to add additional hardware, software to the security system? For the proximity report and contagion report, the answer is no, right? As long as you're running a relatively recent version of Genetec Synergist, you don't need to add anything additional. In terms of the thermal solution, that's just an endpoint for Genetec. So that's a Mobotics camera on that thermal mobile cart, and that just can be read natively within Genetec as a native endpoint. So there's no additional hardware there needed. When you talk about things like RTLS, that's where there's additional equipment, right? So you're going to have beacons and sensors that get deployed in the field. So that's a whole solution that Genetec is tying in with, but there is certainly additional hardware and software there. Let's see here. Security Center is the dashboard for the Dell solution. Dell is the compute and storage that the Genetec solution resides on. So hopefully that answers the question there. Let's see. Does Genetec have access control plugins where we could utilize this technology while keeping our own infrastructure? Absolutely. So that the RTLS is a plugin, right? That's a plugin that we've been developing for some time with one of our third-party partners, and you can keep your infrastructure in place, and you can bolt these plugins on. And as I mentioned with RTLS, there is some additional infrastructure that you would need to put out in the field in terms of hardware, but it's meant to be a bolt-on to Genetec. Question here, do you need more licenses for the cameras? So when we refer to thermal, yes, that's a camera license. So, the cart, I mean, John, maybe you can speak to this, but the cart itself.
Yeah, I can talk to the licenses. Yeah, the card itself is going to be all in one. So you're going to be able to do, a lot of what you're looking to do from a temperature detection on that card. There's going to be licenses built in there. It's going to have the facial detection technology in there. Most of the data is actually going to be, if it's on the card, it's going to be hosted on that screen. In most cases, there's no streaming video. It's just capturing those photos with a unique identifier, so there's no personal information going through. It's really just metadata that's feeding through there. However, for those customers that are looking to tie it into their VMS, then yes, there would be additional licenses for the cameras in order to handle that.
Awesome. Another great question that came in here. Any thoughts or plans on possibly integrating with the hospital's EMR systems? That's one that comes up often. Very great question. I can tell you that some of the larger players in that EMR space, it is certainly something that we have looked at. It's on the future roadmap, but we would like to tie much more closely to the EMR to be able to provide that single pane of glass, single interface for the hospital staff. So the answer today is no, but certainly plans to look at that.
Yeah, and Ty, it's a great question because it actually is a little bit more over-encompassing than that. A lot of the solutions that we talked about today are ones that our customers are looking to deploy extremely quickly. So because of that, they don't want to have to go through any additional privacy concerns that they might have to. It's one of the reasons why the card solution has the LTE router on there, so that it doesn't tie to the network. So I think as these solutions start to become more of the norm, as we kind of get through this initial phase, it's deployed. It's something that that the hospitals recognize and they're familiar with. Then I think we start to see the integration points to be even more and expand. And I think that's the reason why it's so important to have an open, agile, and scalable system, because you don't know what's going to happen down the line. So having companies that can come together and deploy these solutions and also be, I hate to use the word, but future-proof, in order to make sure that it can be implemented into other systems down the line is extremely important.
Yeah, definitely, John. One point of clarity that I want to make on one of the questions, where somebody asked about the access control plugins that Genetec has. I should have mentioned this, but Genetec does have plugins with many of the major access control manufacturers out there: Linnell, Software House, AMAG. You can certainly utilize those plugins to bring that data into Genetec and have that more holistic view, and then take advantage of some of the other solutions that John and I talked about today, be it RTLS or be it the thermal imaging mobile cart. So that's one thing I wanted to clarify there on that question. Great questions so far. Looks like they've started to slow down a little bit. Actually, another one just popped in. Great. Okay, it was just more of a comment than a question. I think we're good. We've got plenty of time, so we'll let this go here for a little bit longer, so you can continue to ask questions, and John and I will be happy to answer them. So please feel free to put anything into that Q&A box. All right, I think that's it. I mean, the questions have slowed down quite a bit. So, actually, just one more just came through. Do we order the mobile cart through Dell Direct? I will let John answer that one.
Yeah, so we can certainly do that direct or go through a partner as well. So multiple procurement, whatever is your choice, we can do. But yeah, the whole cart, the entire solution can be ordered through Dell.
Excellent. And all of our contact information is here on this last slide. If you want to jot down either myself or John's email address, please send us, any follow-up questions to this. We'd be happy to answer. Another one that just came in: are there ways to blur our patients' faces for privacy purposes? Excellent question. When we talk about privacy, Genetec has some really unique solutions built around privacy. One of them being a privacy protection video analytic. So if, as a follow-up to one of the other questions where somebody asked about HIPAA and privacy concerns, you could utilize this analytic to essentially distort and anonymize the individual in the scene while still being able to see what's happening in the scene. So that's a really good question and a point. But there are various ways to still comply with HIPAA and privacy, but maintain security at the same time. Give it a couple more seconds here, because it seems every time that I get ready to close, there a couple more pops in. So great. Just more comments that this was helpful. Thank you. Absolutely. It was John and I's pleasure to present and share this information with you guys today. Like I said, we will make this webinar publicly available, so you guys will be able to view this again if you'd like, or share it with anyone that you'd like. And feel free to send us any questions following this presentation if they come up. with that, we'll sign off. Thank you guys very much.
Thanks, everyone. Appreciate the time.